you guys, this is Bryce. I have one of my favorites here. Carla, she's with us. This is Bryce's corner. Carla's been having a little bit of feet pain. So she's briefly described what some of her foot pain is, mostly on the right.
On my right foot.
On your right foot. And she has a little bit of big toe pain. So M1, not a big bunion or anything like that, but a little bit of ossification around that joint there. So we're gonna do a couple exercises to try to help you with that. Yeah. Because it's been bothering her. She loves to walk, she has dogs, she walks for exercise, she does performance training.
Yeah.
Performance training. Cleans, jerks, she's very good at doing them. So a lot of explosive movement that requires that lift off from your foot to try to move a lot of weight, right? So here we go. All right, so we have our shoes off. We already had our shoes off, but in case you missed it. We're gonna start with something called piano toes. So if you don't know what piano toes are, think about your fingers going across the piano. We're gonna lift the toes up and we're gonna try to bring one toe down at a time. Now, as we find the coordination of this, try to lift. We're trying to reach one toe down at a time and not all the toes down at a time. We wanna spread those toes out. Like you wanna get wide between that pinky toe and that big toe. And what I really like when we do this is try not to rock the ankle. So try to keep the heel in position and try to put one down at a time. Try not to curl them over. Try to reach them out and put them down one at a time. So what this does is it creates some disassociation between the front of the foot and the rear of the foot, where we can get that rotational position. Because again, when we walk, a lot of times our goal is we kind of hit a little bit on that lateral heel, and as we come down into that first toe, we kind of rock through that first toe. So there's a little bit of that counter rotation that happens between the rear foot and the forefoot. So we want to try to educate that, and what that does is it moves all of the foot bones or the metatarsals, along with some of the arch bones, which are your cuneiform bones in your navicular and your cuboid. And we're trying to get that to rotate and move with the rear foot, which is how those bones butt up against the talus and the calcaneus. So that's usually the first thing I like to do, is just to kind of coordinate some rotational movements. And do you get any pain when you lift the toes up?
Just in my big toe.
Just in your big toe. So one thing that we're gonna look at too is lift this toe up. See how we have nice extension there? Lift this toe up, not as much, right? So we're gonna use that as our baseline right now. We're gonna try, do you have any pain at the top of the foot now when you do that?
Yeah.
A little bit, like it's pinching a little bit there? Mm-hmm. Okay, so we're gonna come back to that because we're gonna do a couple other mobility exercises. So piano toes, good warm-up exercise for the feet. Now we're gonna do a couple other exercises. All right, so the first thing we're gonna do is we want to try to increase potentially how her toe is moving. Now we saw a little bit of the ossification around the toe, which is pretty normal for a lot of people out there, especially if you've got really progressed bunion positions and the toe angle starts to change. But we're gonna see if we can try to create a little bit of mobility here. So that we don't create more pain. So when she lifts her toe up, she feels a little bit of discomfort. We're gonna try to open up the top of the foot. So go ahead and take your foot back and point your toes back, and we're gonna get like on the top of the foot. So the first thing we're gonna do is just keep the foot straight where the heel and the toes are in line with each other, and then try to push the front of your ankle forward, like you're trying to stretch the front of the foot. So you're trying to get that stretch here, right? So push forward, okay? And so right now she's a little bit more through the little toes, which is fine. That's one part of it, which is stretching more the digitorum portion of the extensors. And then if she rolls over onto the big toe part, she gets a little bit of discomfort. So we're gonna move this back a little bit, okay? And just gently roll that forward and push. You get a little bit of discomfort, right? Mm-hmm. So roll a little bit more towards the big toe and just be gentle, 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 gentle. And you feel that stretching through there, right?
Yeah, that feels good.
Okay, so try to maintain that. You can keep this leg straight, good. And just work at your tolerance. So again, you don't need to jam the foot into a position. We just want to create a little bit of tension through that big toe extensor. Good, we're just gonna hold it for 30 seconds. Okay, let's go ahead and relax real quick. Go ahead and just move those toes around a little bit, okay? And let's go one more time back in position, and we're gonna do something a little bit different. Okay, so roll towards that big toe a little bit. Okay, great. I'm gonna see if I can move you a little bit here. So now we're a little bit more on that big toe, is that okay? Borderline?
Borderline, but I'm good.
Okay, all right. So we're gonna go ahead and stretch that. Does it feel tight in there?
A little bit, yeah.
Okay, so stay in that position and now push the top of your toe like you're trying to lift your toes, but you're pushing into the ground. So push, 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 push. Push down into the ground, push down into the ground, push down into the ground. Try to not to push from the foot like you want to raise your toes up. Does that make sense?
Yeah.
So just from the toes. So she's activating those muscles and some of those tendon attachments, right, towards the toe. And then we're going to go ahead and relax that. Go ahead and take that toe out of there and just move those toes around again. Okay. Face forward for us and just lift the toes up again. Okay, so that stays down. So lift this big toe and lift that toe. Keep this down though. Okay, less discomfort, same discomfort.
It's less discomfort.
Okay, so we've got a little bit, and I would say we have a little bit of increased height here, right? So all we did was try to mobilize what was going on the top of the foot, because if I try to jam her into a toe extension position and try to stretch what's underneath, that may not feel too good. Okay, so we're gonna come back to another exercise. Okay, so we're going to show you a little bit of self-treatment. We've actually gone through several different exercises. There's a couple other limitations that are hard to kind of go over in just a toe rehab video. But we had a positive response from stretching the top of the foot or the top of the toe. That helped increase range of motion as far as extension and less pain. When we did some different positions for trying to stretch into extension, trying to stretch the flexors, there was too much discomfort. Trying to get her to bend her knee all the way to try to get into a stretch for the shin or the anterior tibialis was a little bit too painful for the knee. So we have some limitations here. So what we're gonna do is we're gonna do a little bit of self-treatment. So I've taught a lot of my clients to kind of pump. When we say pump, we wanna move the fluid in the joint themselves. So if you just cross your leg over, okay, and just grab that toe, and you want to pull it away, and you want to kind of give it a little figure eight. And so we're going to distract or pull away, and we want to try to create a little bit of figure eight through the joint, like you're doing a figure eight like this, like a little wave, right?
Yeah.
Okay. And so what we're doing is we're opening that joint up, and we're moving that joint around, and we start with just this little wave position, and however long it takes. Could take 20 rounds, 30 rounds, 50 rounds. When we feel like it kind of loosens up and it feels like it's a little bit more fluidic, like there's more fluid in the joint, that's usually the benefit. Okay, and then we can work a little bit more active. So what you'll do now is, like, you want to point your toe. So if you think about not totally flexing it over, but just kind of like point it. Yeah, like that. And so what we're going to do is we're going to pull the toe, we're going to point the toe, we're going to relax the point, but we want to keep pulling on it. Okay, so we're going to pull, point, relax the point, relax the pull. Pull, point, relax the point, and relax the pull. And we're going to keep doing that over and over again, and we can work at a little bit more of an increased pace. And every time we kind of contract and relax, we should almost feel like the joint of the toe kind of opens up a little bit, like it's separating a little bit. Yeah, like that. So point, and that is actively pumping the toe joint. Okay. And again, we can do this 20, 30, 40, 50 times until we feel like we increase some fluidity around that joint space. Because again, when we have osteoarthritis, especially if it's chronic cases, and we've got years of stress in that joint, and we start to get that ossification, which is where the bone starts to grow around that area, which is part of that bunion development, that there's not a lot of space in that joint. So we have to get that fluidity back in there that is important for now increasing range of motion for that toe or that joint, so that we can move the joint properly or do the rehab that we need to do to try to correct the stress that's on that foot. And she's already done things like increase her foot position in the shoes. Like she buys wide toe box shoes so that the toes have space. That's usually the detriment of most women in like shoes and things like that, is they tend to be very narrow, or if you're wearing like dress shoes or heels or anything like that, everything just compresses into that big toe. So making sure that there's enough space for the toes and enough space for the foot is really important, especially when you've got a history of some of these things. Okay, so you've probably done what, 20 reps
20,
of each one of those? So stand up for a second. Let's check what that toe looks like in regards to movement.
I feel like it's,
And I feel like it's higher. I feel like we're a little bit higher here.
there's less pain.
And there's less pain, so that it's not pinching here, right? Okay. So then take that foot back behind you and put yourself in that stretch position again. So like, yeah, the toes underneath. Is that less painful too? Kind of getting into that stretch a little bit?
It is, a little bit.
It's a little bit more warmed up. Okay, so then bring the foot back and let's do an extension test again. So keep this part down, but lift the big toe. Yeah. Yeah, I think that that's a lot better, and it seems like it's moving better through the tissue line here, and then come back down. So I'm gonna keep that up and now push down onto my finger. Yeah, push, 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 and relax, and now go up again. So keep these toes down. Can you lift just the big toe?
Yeah.
How's that feel? Look at that.
It's so much higher.
So much higher. Okay. So now push down again. Push, 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 push. Keep pushing, keep pushing, keep pushing, keep pushing, keep pushing. Manage your spine. Push, 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 and relax. And now lift the big toe again. Just the big toe. Yeah. So again, in about 10 minutes, we've increased some range of motion here. There's less pain.
Yeah.
So there's definitely some ability to try to recover how this joint is moving. And this is, again, usually her bad knee. So there might be some compensation in regards to how she's walking or putting pressure through the foot, because this knee has had issues. She's had prior surgery, ACL issue, and stuff like that. So there might be sort of a chain of events of things that are going on here in regards to even looking at what her pelvic balance is. But simple exercises for you guys to check out at home. You can do different stretches for your toes. You can't ignore your feet. You can't ignore your hands. These are the things that we're using all day long. And sometimes we do ignore them, and then until they start to hurt, and we can't use them the right way. So make sure that if you're doing recovery programs, stretching, mobility, that you do the things to open your hands up, open your toes up, move the feet around, stretch the feet, stretch the hands, the forearms, the calves. All these things are super important. So we'll see you next time.